Hi, my name is Karen Rasponi, and I'm in your First Aid Kines 220 V84 section. That's the online section. This is my friend Zach, and he's going to help me out for this video. He has injured his hand, and we're going to assess it and bandage it today. So the most important part is the first step, and that's gaining consent. So anytime you want to assess an injury or bandage any wound, you first have to make sure that it's okay with the person who's been injured. Hey Zach, I'm trained in first aid. Do you mind if I help you bandage your wound?
Yes, please help.
Okay, so first thing you want to do is your primary check. So you want to, first of all, get a first impression, like determine whether they're injured, and then make sure that they're responsive and they're breathing properly. And obviously, Zach is doing both of these things. He's alive and he's breathing. Next, we don't have any obvious bleeding otherwise, just a little bit of blood on the hand. And so the next part would be checking to see if there's any way of me coming in contact with his blood. And since there is, since his hand is bleeding, then we would have to put on gloves for this part. All right. So next we can check the responsiveness of the victim. And this is going to start with kind of an introduction. So first I'll talk to Zach and say, hey, I mean, you know me already, but I'm Karen. I'm going to help you bandage your wound now. What is your name?
I'm Zach.
So the next couple of questions, this is mainly just to make sure that they're coherent and responsive before you start going into the process of helping them out. So do you know where you are?
I do.
Okay. What is the month and year right now?
It's April 2016.
Okay. And do you know what happened to your hand?
I do not.
Okay.
I cut it. I cut my hand.
I cut your hand. Okay. So we're going to make sure that Zach is breathing. His chest is moving. He's breathing in and out. So clearly he's all right, and he's proven that he's coherent. So now we don't really need to position him since he's awake and standing and fine, and this isn't any kind of spinal or head injury. So there's no positioning necessary there. But at this point, we can proceed. We have consent. We have analyzed everything, and we can start bandaging the wound. So anytime you're bandaging a hand wound, the first thing that you want to do is anchor it at the palm of the hand. So you'll start with 1 or 2 wraps just to make sure it holds. And then from that point, you're going to start alternating between wrapping on this side of the thumb and wrapping on the palm. So we're going to wrap around his thumb fairly high and then back around the palm. And as you're doing this, it's kind of going to create a crisscross pattern. You can see I don't know if you can see in this video, but you can kind of see the different layers of the bandage as we're going through this. And we're just going to kind of go until we are out of bandage. And then secure it. All right, so we have a bandaged hand now. Ta-da! So past that point, if we had to clean his hand or use any antiseptic, or if we got blood on any gauze or anything, we would have to properly dispose of all of this. And as I was going, I was telling him exactly what I was doing with wrapping so that he knew everything that was going to happen. And now we can start cleaning up. So just as we showed in the last video, we're good. So just as we showed in the last video, we do have our 4-step process of how we need to take our gloves off. So once you take your gloves off, just like we learned previously, you cannot dispose of them by throwing them in a trash can. We talked about that as well. You need to make sure that your gloves are contained within themselves, and the only part of the glove that you're touching is the part that was on your hand. So you do not run the risk of getting any blood or diseases communicated through this path. So now we would have to put these in a Ziploc bag so that we could dispose of them later and make sure that through the trash no diseases or blood is communicated. So that's pretty much it. So I'm Karen Rasponi. This was how to bandage a hand.